بسم الله الرحمن الرحيم. أهلا بكم طلاب وأطباء طب الفم والأسنان في International Online Dental Uses Congress في نسخته الأولى من اتحاد الجامعات العلمية لطب الأسنان وحديث التخرج والتابع ل EADS Egyptian Association of Dental Students، وهي الجهة العلمية الوحيدة الموثقة في مصر والتابعة للاتحاد العلمي فيما يحض الطالب وحديث التخرج داخل الجامعات المصرية. وهدفنا هو تطوير وتعليم طلاب الأسنان في جميع مجالات الأسنان، كما نهدف إلى تطوير الطلاب في أجزاء أخرى مثل السوفت سكيلز. ونحن متواجدين الآن في أكثر من 33 جامعة، ويتضمن المؤتمر أكثر من 100 دكتور من مصر وخارج مصر من الدول العربية والإفريقية المختلفة من كبار الدكاترة والأساتذة المتواجدين. وسوف تحصل على شهادة معتمدة بعد حضورك نسب الحضور المطلوبة للمؤتمر. وهناك سحوبات يومية تصل قيمتها المالية إلى 4000 جنيه مصريا، وإجمالي السحوبات في المؤتمر تصل إلى 50,000 جنيه مصريا. ونعلن عن الشراكة بيننا وبين دول لبنان، فلسطين، السودان، رواندا، قطر، السعودية، تونس، المغرب، تنزانيا. نتشرف بالإعلان عن بورد الرسمي للمؤتمر رئيس المؤتمر الأستاذ الدكتور عبد الفتاح صدقة، الرئيس الشرفي للمؤتمر الدكتور حاتم الجندي، السكرتير العام للمؤتمر الأستاذة الدكتورة هالة هزاع، اللجنة العلمية للمؤتمر الأستاذة الدكتورة عليا محروس، المشرف الأكاديمي الأستاذ الدكتور جايلان الجندي، الضيف الشرفي للمؤتمر الأستاذ الدكتور شذا حماد.
Okay, Doctor, you can start now.
Yes, please. Thank you. Hello, everybody. It's a great honor to be with you this evening. I am Dr. Michel Mbonimana from a beautiful country of Rwanda in the heart of Africa. And I'm a general dentist working at Kigali Adventist Dental Clinic. And it's a great honor and a privilege to be invited and share a lecture with you and some knowledge. Thank you, and thank you for the organizers. And I would like to thank very much for the EADS, which is the only certified association which is able to organize the online International Dental Youth Congress, the IODSC, YSC. So it's a great privilege to work with you and work with the EADS. And may God bless you and continue to give you more knowledge and strength to organize this Congress, which is very beneficial to all of us. And I would also to request those who are following that you may please go and like and share and fill the Google form so that you may have a certificate after the lecture for this online International Congress, Youth Congress. So to start with, I would like to share my knowledge and my experience in my dental practice. I've been working since 2013, 9 years now. This is my ninth year after my graduation. But there is a subject that I would like to share about knowledge and attitude towards prosthesis. It's a research study which was done in the Philippines, and it's titled as Relationship Between Knowledge and Attitude of Carmen Community Regarding Replacement of Missing Teeth. The reason why I chose replacement of missing teeth, because some people choose not to replace the missing teeth when they have lost them or tooth, and some they choose to replace their missing teeth or missing tooth. So the knowledge and attitude of different people in different areas is different. So this research has been done in the Philippines. It's an international research because I'm from Africa, but it was done in a small community of Carmen people. As you see, Philippines and relationship to Africa is really quite long. But this Carmen community is found in the Philippines, and they were very cooperative with me because it's a survey, a research that I did, and I would like to share some findings that and recommendation that I got from the research. To continue, let me tell you a bit about me. I was born in 1987 in the heart of Africa, in a beautiful country of 1,000 hills, Rwanda. And I am a graduate of the Adventist University of the Philippines and graduated as Doctor of Dental Medicine in March 2013. It is now I'm an experienced general dentist, managing director as well at Kigali Adventist Dental Clinic in Rwanda. And driven by the love for people's oral health and wellness, I take pride in providing the best dental treatments possible. And also as a dental clinic manager and a managing director, my goals are teamwork and patient satisfaction. And in addition to that, I've been recognized by the Rwanda Union Mission for the heart to serve my people and other people who come to our clinic. And also I'm an author of a book, simple book, which is you can read online on Amazon, which is entitled as A Tooth of Dental Health. I think that's all about me, but I'm glad and I hope we are going to share some thoughts about this subject of replacing missing teeth right now in the moment. Thank you. There are questions that I asked myself before I started. One of these is, if you lose or you have lost one of your tooth, there are two questions that I would like to ask you. Would you go for tooth replacement or you will not? Would you want a tooth replacement or you will not? The answer is simple, it's yes or not. And then depending on your answer, why would you go for tooth replacement and why would you not go for tooth replacement? And your answers will determine your knowledge and your attitudes towards tooth replacement. It's a very small exercise you can do by yourself in your mind. If unfortunately you have lost one of your tooth, have you gone for tooth replacement? If yes, that's your knowledge and attitude towards it. It explains many things about you. And if you have not gone for tooth replacement, you might have different reasons that we are going to discuss later, including cost or time. But some communities, they choose not to replace their missing teeth. And some of them, they do it even they voluntarily remove their teeth because of the culture, which we are going to see right now. And the third question is there any significant relationship between knowledge and attitudes regarding replacement of missing teeth? Yeah, to have knowledge, it's something else, and to have attitude towards that knowledge, also something else that we are going to discuss. Does my knowledge on prosthesis determine my attitudes? If I'm knowledgeable about replacing my tooth or my teeth, what attitudes now do I have if I know that it's possible to replace it? And fifth question, is there any significant difference in the attitude of certain communities regarding replacement of missing teeth? So these communities that I'm talking about, for example, is the attitude of the Maasai community in Kenya different from the attitude of the community in the West countries, like in the US or Canada, or else in the world, or regarding replacement of missing teeth? So the picture you see there on the upper side, it's a picture of the Maasai from Tanzania. And the picture you have down is the Maasai picture of the Maasai from Kenya. And sometimes they have different opinion about removing some of the front teeth, especially the lower ones that we are going to discuss later. So that I can say the attitude of the Maasai from Tanzania are different from the attitudes of the Maasai from Kenya regarding replacement of missing teeth. So that's what this study or this lecture is going to talk about, is my knowledge on replacement missing teeth. Is it going to affect my attitude towards it? And on the outline, short outline, we're going to discuss about the definition of terms, the background, tooth loss factors, and then replacement of missing teeth types. Then we are going deep into the research, the Carmen community research study, the results, the conclusion, the recommendation that we've gotten, and then the conclusion of the whole lecture, and then some few questions that you may ask me in this lecture, after the lecture. Let's go deep now. Some definition of terms that we're going to discuss mostly are like three. First, knowledge. Second, attitude. And then prosthesis. In this case, we are talking about dental prosthesis because there are different types of body prosthesis. So in this lecture, we are going to talk about the dental, since we are talking about dental, we are in the dental profession. So what is knowledge? Knowledge can be defined as awareness of facts or as practical skills, and may also refer to familiarity with objects or situations. This definition was found in Wikipedia, in the free encyclopedia. That's where I got this definition. It is an awareness of a fact or a practical skills. Then the second word is about attitude. What is my attitude towards something? It is a feeling or an opinion you have about something. For example, in this case, the knowledge on replacement of missing teeth. Then what is my attitude or my opinion or my feeling on replacement of missing teeth? Is my opinion negative or my opinion positive? Should I go for tooth replacement or should I not? So the way you respond to that knowledge is called the attitude. Then the prosthesis, in this case, dental prosthesis, is a dental appliance that replaces a missing tooth or covers up tooth defects. As dental professionals, we are familiar with these words, crown, bridge, implant, all sorts of types of tooth replacement, which we are going also to discuss later. And a prosthesis, as I've said, is an intraoral or inside the mouth prosthesis used to restore or reconstruct intraoral defects such as missing teeth, missing parts of the teeth, and missing soft or hard structures of the jaw and palate. So on some people, you can replace a jaw. On some people, you can replace also a palate or hard palate. So it can be also, you can also use a dental prosthesis, but majority of the prosthesis we know, dental prosthesis, are those used to replace missing tooth or missing teeth. What is the background, which is very interesting here, what I've got. And for example, in Africa, there are so many explanation of beauty. And in South Africa, especially in Cape Town, there is a practice or a ritual extractions of upper front teeth, and it is still practiced nowadays by teenagers, and most of the times it's process from teenage times to adulthood. And because of the peer pressure around those teenagers, they are forced, or they not forced, they choose to remove their upper front teeth as a sign of strength and adulthood. So they are becoming men, or they are becoming adult women. So, and this practice is called the passion gap, or the Cape flat smile. As you can see in the picture, this Cape flat smile is seen on that lady. So this is called beauty in South Africa, especially in Cape Town. So fashion and peer pressure are the main reasons for these trained children as young as 11 have had their upper front teeth removed for aesthetic reasons or purpose. And this is what it was found in The Perfect Smile, part 1, published in September 2018 by Ross. You can find it in British Dental Journal. Another example that I'm going to give is an example of beauty. A removal of lower front teeth can be found in Sudan, in the tribe called Dinka or Dinka, and mainly in the rural areas in South Sahara regions for different purposes. So for them, beauty is removing their lower anterior teeth, especially the incisors. And in South Africa, they remove the upper front teeth, the incisors mostly. And those two communities, they have different knowledge about beauty, about teeth, about missing teeth and replacement of missing teeth. And definitely they have two different attitudes towards replacement. But what the common point is, they will never choose for tooth replacement, because for them, removing their teeth is beauty. So the teeth are removed quite soon after they have erupted. This act is seen as a rite of passage, and some believe that removing their lower front teeth could enhance their beauty. As you see in the picture, there is a lady. Perhaps she's going to get married, because you can see on the side there all the ladies, and the one in the middle is a younger lady. So for her, beauty is missing lower front teeth, especially the incisors. In Ghana, now we move to Ghana in the West Africa. We've started with the South Africa, now in the North Central Africa, Sudan, now we are going to West Africa. In Ghana and also Namibia is Southeast Africa, and Nigeria, which is the West Africa, a gap or a diastema in the middle diastema in women's teeth is believed by some to be a sign of beauty and fertility, says Bernice Agwekwena, a Ghanaian journalist and Gates Fellow of African Agriculture at the University of California, Berkeley's Graduate School of Journalism. And a diastema, in middle diastema, it's common in Africa. So the middle diastema, for many Africans, it's beauty, but in West Africa, in West countries like US or in the Europe, they don't like middle diastema. So I get many patients from there who tells me that they would like to close the gap or the diastema. And for them, it's beauty to not have the diastema. But in Africa, I get some patients who ask me even to make a gap or diastema in the middle of their upper incisors. So the knowledge of that beauty or that gap is different, and the attitude of these two people is also different. Some women even go to an extent of creating an artificial gap, as I was saying, in their teeth, because they want to meet the traditional standards set for African beauty. Yeah, so it's very known and it's common. Maybe it's common also to you. I don't know which country you are, but you can relate also in your country. If a diastema, a middle diastema is beauty in your country or not. So the knowledge and the attitude towards closing that gap is different from two different communities or countries. But here we are not talking about a gap, but we are talking about medial diastema. We are talking about a missing tooth. There is also a practice very known in Africa because so many researchers on Google talk about this oral mutilation. I don't see oral mutilation in other areas of the world. Mostly the researches that has been done, they were done in Africa because that's where it's common. The infant oral mutilation, especially, I've seen that it is mostly found in the Central East Africa, where they practice this mutilation. What is that? It's a germectomy. So a removal of early extraction of primary or permanent incisors and canines, especially in the primary, in the lower jaw. So at 6 months or 7 months, a baby starts to cry, has fever, cannot breastfeed, cannot sleep. So the mother is going to say, okay, my baby is sick and there is no healthcare provider next to her. So a certified health care provider. So she goes to a traditional health care provider who is not even certified, maybe using not the correct materials or instruments. So that traditional healthcare provider is going to remove, going to see the baby's mouth and they will see a swelling, a pus-like swelling, so an abscess. And that is a sign of tooth eruption. So that person, that traditional healthcare is going to remove that primary tooth pad, and it's very early, not yet time. And by removing it, he might also affect or also touch the tooth pad of the permanent tooth, which is going to, and most of the time they remove also the tooth pad of the permanent teeth. And the child is going to be into adulthood without any missing and any tooth in that area. So that is called oral mutilation because it's a wrong practice and most of the time which can be cured by antibiotics or oral hygiene with a certified health care provider. So it's a germectomy is mostly used, and as you see in the picture there, it's a man or a woman, an adult man, especially it's a man, who has no central incisor, especially the right upper central incisor, and also the canine came in the wrong position. Instead of the canine being in the middle of the first primary premolar, and the upper lateral incisor, it has changed. It's like a lateral incisor. It's like a right upper lateral incisor because it has been disturbed during oral mutilation when he was a child. So in a study which was done also by Crott in dental ritual mutilation and forensic odontologists in 2015, they found out that the dental ritual mutilation and dental decoration were still practiced among the ethnic groups and cultures. Throughout the history of humanity, having healthy teeth has a symbolic meaning of youth, beauty, and strength, but it can also have other meanings. when you see a person who doesn't have teeth, sometimes it's not aesthetic at all. And some of them, when they smile, they cover their mouth because they don't want to share what the dentary area. So that's why they say teeth, it's a sign of youth and beauty and strength. A youth who doesn't have teeth looks like an adult, an old person. So everybody wants to look young. So that's why most of the time we go for tooth replacement. But for some areas, missing teeth or tooth is part of beauty and youth and strength. So the attitude and knowledge on this area of replacement of missing teeth is different. So dental ritual mutilations were documented in many cultures in the past and were practiced mainly for religious rituals purposes, for aesthetic reasons, and because they represent a symbol of a status or of belonging to a particular social group. So it's not only in Africa, but this practice also is still done in many parts of the world. And it can include removing primary teeth, shaping teeth, incisors or canines, or cover them with gold or metals, all sorts of materials that is included in dental mutilations. An example, as a child, you can see she doesn't have the primary canine. Probably they have been removed by this practice of oral mutilation. And by any chance, if they haven't touched the tooth pads for permanent teeth, that's a very good news. Then he will have the permanent canine. But if they have also removed the permanent tooth pad, then the child will never have any permanent lower right canine and lower left canine, which is a sad news for in many areas. And this practice should be not encouraged. It should stop. So an example of certain areas that they do this extraction of certain teeth, the table shows that the tribes practicing teeth avulsion or extraction and their geographic areas where they are widespread. So it is found in the whole part of the world, not only in Africa. So as we have studied, in South Africa, they practice removal of the front teeth. In Sudan, in the Dinka, they practice removal of the lower incisors and canines. And then in Sudan, South Saharan tribes, they also practice lower incisors removal and canine. In the tribe of Kenya and Tanzania, the Luo tribe, they also practice a removal of the 6 lower teeth. So the 6 lower teeth, they are the molars. Then in the Maasai tribe in Kenya, they practice removal of the lower incisors, as we have seen in the pictures. Let's move. Also in Kenya, in another table is about the Jebel Moya. I think it's in Kenya as well. They practice the removal of 2 lower incisors. In the new hybrids, in the females especially, the 2 upper central incisors. Then in Cameroon, they practice removal of the 4 upper incisors. So no anteriors, upper anteriors. So for them, it's beauty and strength and youth. In Mali, the same thing. In Mozambique, in Borneo, the same thing. They practice the removal of the upper incisors. Also in Australia, they also practice the removal of some teeth, but they don't specify which ones, and especially in the Aboriginal Australia. So as you see, there is a wide range of this practice of extraction of natural teeth as sign of beauty and strength. So what are the tooth loss factors? The tooth loss factors are influenced by biology and genetic. So biology, a child is born, the primary teeth erupt, and then they exfoliate at the right time at 6 years old or 5 years old. They exfoliate, so which is a sign of, it's a part of youth and growth. It's biological. And at the age of 17 to 21, wisdom teeth, they also erupt. It's part of biology. It's part of growth, which is normal. And then genetic, you can inherit a missing tooth from a parent or in the family. So if your father doesn't have lower first permanent premolars, so that means the child might not also have these lower premolars. And there are so many examples that so many people, they also don't have upper lateral incisors, which can be a genetic also. And there is nothing we can do about it because it's genetic. But is also a key indicator of the dental care utilization and access. So it can be biological, it can be genetic, but also it can be from a dental practitioner. So many dentists in the past used to treat their patient by just removing their teeth. So that was the easiest treatment they could provide back then, because fillings, root canal were not practiced back then. But now dentistry has evolved. So many treatments, new and very good treatments are upcoming. So the extraction treatments, it's the last option that we can do in our dental settings, because we have to save, not removing teeth. So we are here to help people have their safe teeth and their full dentures, have their full set of teeth, not just to pull out the teeth. So some dentists, they can also play a big role in removing their patient's teeth. Teeth are lost mainly because someone extracts them, and who extract them, most of the time, they are dentists, and is inherently associated with culture and attitudes, including patients and dentists' philosophies of dental care. So culture, attitude of patients and dentists can also affect or be a factor on tooth loss. Indeed, it is a grave error to dismiss this importance of the complex pattern of the roles, responsibilities, norms, values, freedom, and limitation that define what is taught as masculine and feminine in a given time and place in influencing health. So in some areas or countries, to be masculine, it means to remove their upper front teeth. And some areas, for example, in Sudan, to be beautiful is to remove their front lower teeth. So it's the knowledge and attitude is different in different communities. As you can see, tooth loss factors can be influenced by sex or gender. It can be also genetic. It can be also because of caries or periodontitis. It can be physiology, as I said, caries and periodontitis, which is part of the oral diseases. It can be also from a dental care utilization, a dentist or any dental provider. It can be also behavior or attitude of a person. It can be also a socio-economic status, because people who cannot afford dental treatments, so most of the time they choose tooth extraction when they have toothache. So it can be also a socio-economic status, the poor or the rich or the middle income people. But the poor, most of the time, they don't afford healthcare, so they most of the time choose extractions. So the risk factors of tooth loss, there are so many. One of them is being over 35. So that means the bones are kind of soft, so people are getting systemic diseases. They don't take care of their teeth, as we are going to see. So over 35, you are at risk of losing your tooth. So if you are at 30, you are 35, and I'm 35, I should really take care of my oral health, because I might lose my tooth if I'm not careful. So being a male, why male lose their teeth more than female? Because male, they do fun experiences, like removing bottle of soft drinks with their teeth, doing crazy stuff using their teeth. But women, they really take care of themselves. They take care of their beauty. Most of the time, they don't do dangerous practices. Never getting professional dental care in some areas. And the second part is never using a toothbrush. Some people don't have toothbrush, even toothpaste. Some people who currently smoke in the past or who are smoking, they're also at risk of missing teeth or losing their teeth. Then also tooth types. Molars tend to stay longer than the incisors or the front teeth, because when you have an accident or you are knocked out, so the front teeth are the one to receive the first shock, but the molars, they tend to come out last. Then having people who have diabetes, they most of the time suffer from periodontitis. People who have high blood pressure, those who have arthritis. So those people, they are at risk of losing their teeth. And this study was found in risk factors for tooth in June 2021 by Alfan Acha from the Chicago Dental New Teeth Chicago Dental in Chicago. So that's a journal. And then also major factors responsible for tooth loss can be smoking, lack of nutrition, diabetes, gum disease, and arthritis. So I'm not discuss much of this, but they can be also risk factors of tooth loss. So there are so many options if you have a missing tooth. So if you have a missing tooth, there are so many options that you can go to a dentist or a dental health care provider, and that dental health provider is going to help you and give you so many options you can choose to replace that gap you see in the picture. So replacement of missing teeth types, it can be a removable denture, partial denture. It can be also a fixed bridge, can be also an implant. And those are the types of tooth replacement we do in the dental setting. It can be also a full denture. There are so many people, especially our elderly people, who don't have any tooth. So you can have a denture, removable denture, or a fixed denture with implants supporting the denture. So many options. Yeah. And as we move now, lastly, let's go to the research. And the research, it's about the Carmen community research, which was done in the Philippines. And before we move on, I would like to encourage you to like and share, and also fill up the form, the questionnaire form, so that you can get your certificate after the lecture. So the Carmen community, as I said, it's found in the Philippines. It's a very small community. So the research was done in 2013. It's all about relationship between knowledge and attitude of this community regarding replacement of missing teeth. So it's a survey type, a descriptive research. So questionnaires were provided. I was included part of the group, were given to the community, and we collected the samples and collected the questionnaires, field questionnaires, and methodologically we interpreted them, and the findings And the results are the ones that I'm going to discuss right now. So the mystery behind human growth and aging. So if I say growth and aging, so growth is when a baby grows, gets their primary teeth at 6 months, and at 6 years or 5 years, they get their permanent teeth. That's part of growth, and they lose also their primary teeth. The primary teeth exfoliate. So it's part of growth, and it's a good sign, and we are happy about that when we see a child who doesn't have teeth. So it's part of growth, and it's beautiful, and we cannot talk about it anything about that. But when we talk about aging, nobody's happy about aging, because when you age, you lose some of your teeth. So many researchers or so many studies are still being done nowadays to study the growth and aging of a human body. And it has really raised a lot of researchers' minds to study and understand every single part of the tooth of the body, including the tooth. In some countries, the edentalism or the missing teeth process is considered a natural part of aging. In many cases, healthy teeth are even removed to provide a clear space for the prosthesis, as we've discussed. So most of the individuals who experience edentalism are found to reside independently in urban areas, and most have some of the systemic health complications. So as we discussed, people who are less fortunate cannot afford dental treatments. They are found in the rural areas, and few are found in the cities. But still in the cities, that people cannot afford healthcare or dental treatments. So missing teeth or this edentalism process, so it can be found either in the cities or in the rural areas, and mostly is found in people who cannot afford, the poor. And as we have seen, there are even those who choose to remove their teeth because of especially the culture reasons, which is still practiced even today in certain areas or countries. So interestingly enough, most are happy with their appearance, but oddly enough, complain of symptoms related to depression. So you might find an elderly person who doesn't have front teeth, upper front teeth, or lower front teeth, and you ask him or her, "Are you happy?" Then he will say, "Yeah, I'm really happy with my look, my appearance." But later, when you dig deeper and then you ask some question, they will say, "Well, I'm depressed," or you see they're sad, their mentally health is quite questionable. So where this depression comes from? Perhaps because of their look or their appearance. So when I was in school, we used to provide free dentures to elderly people who could not afford dentures, removable dentures, full dentures. So most of the time, our experiences will be to see an elderly people who before was not smiling at all, while the face was kind of down, could not is having strength. But after the installation of the full denture, you will see that elderly person smiling, see him like he's becoming a youth now. And that person will hug you a lot. And then the following day, he will bring to you fruits, gifts, to just thank you what you have done. But what you have done is just small, just giving him or her teeth. So at that point, you can see that they were depressed, but yet they used to say they are happy with their appearance. But when you give them a denture or replacement of a missing tooth, they will be happy, much more happier than before. So as you see, appearance is very important nowadays. If you or someone you love is experiencing a complication with loss of teeth in the later stage of life, the term usually applied to this dental phenomenon is edentulous, as I explained before. So while most elderly individuals will find the loss of teeth is not a significant impact upon their mental health, they will oddly enough report some mental health complication. If this occurs, there is reasons to be concerned about the loss of teeth upon their bodily self-image. This was found in was being written by Christine Cadena in 2007. So the methodology we used, the researcher used a descriptive correlational research design in order to examine the relationships that existed between the knowledge and the attitude regarding tooth replacement among Carmen community. So a descriptive surveys are used to gain information about characteristics in the field of study by providing a picture of situation as they occur. Correlation studies examine relationships among variables. So this methodology was used, and that's what we have found. So before we got into results, so the conceptual paradigm of the study was between knowledge on tooth replacement and attitude towards tooth replacement. So, but in the middle, the attitude was being influenced or affected by age. So we studied different people, young and old, gender, male and female, accessibility to dental care, educational attainment. There were those who did not go to school, those who just went to high school, and the culture, also barriers. We discussed all of these. So the paradigm illustrates that the patient's knowledge on tooth replacement determines the patient's attitude towards the treatment. However, age, gender, and financial status of the patient play a crucial role in the decision making. So I know, I might, for example, know that replacing my tooth is very important in my life. However, because I don't have money or a dental clinic is very far from my place, so I will choose to not replace my tooth. So my attitude will be, well, I'm satisfied. I don't need a replacement. Though there are so many reasons behind my back that I have no money and I cannot find a dental care provider. So there's so many different reasons. So you can relate in your country, in your area, or with your friend, why your friend doesn't go for a tooth replacement. Your friend might have so many reasons, financial or cultural. Maybe he's satisfied or she's satisfied. Maybe gender, male tend to not care. Accessibility of dental clinics in your area. So there are so many reasons. So the results were majority of the respondents that we questioned were very highly knowledgeable. So the population we were able to attend to, they were highly knowledgeable about replacement of missing teeth. They knew the function of teeth. They knew, they knew that they need teeth for their life, their daily appearance. They were very highly knowledgeable about bridges, about dentures, about implants and crowns as well. The second, the respondents have a moderate and average attitudes towards replacement of missing teeth. So their attitude was not poor at all. So they were able to cooperate. So it was in the middle. They were able to cooperate and get the replacement, but with some reasons, with some aid or support. They did not refuse, but they also accept because of different reasons, especially money or cost. The third, the knowledge of the respondents is not significantly related on their attitude. So what we found out is they were very highly knowledgeable about it, but the attitude was not being affected by the knowledge. The attitude was being affected by something else, money. So regarding replacement of missing teeth, this means that even though they are very highly knowledgeable, it is not really important for them to have tooth replacement for some reasons. So they choose not to have tooth replacements for the reasons I've discussed, financial reasons. The results of the study shows that the gender is not significant. So both explanations were found in male and female were the same. There is no difference on the attitude of male and female respondents towards replacement of missing teeth. And age is not significant as well. There is no difference on the attitude of the respondents within the age bracket of 30 and 20 years old towards replacement of missing teeth. Fifth, the study shows that 80% of the respondents have visited a dentist. So you can see these people they are very highly knowledgeable because they have visited a dentist. 80% is already high, which is a good news in that community. And the rest, 20%, have not visited a dentist yet. So among the 80% of the respondents who have visited already a dentist, 13.3% of them visited a dentist once a semester, which is good. That means twice a year. And 30% of them visited a dentist once a year. 10% of them visited dentists once every 2 years. So in short, in the 80% of the people who visited the dentist, there are few who visited the dentist twice a year, and also quite a number of few people who visited the dentist once a year. The factors which have contributed to the missing one or more teeth among the Carmen community respondents were caries, infection, accident, tooth mobility, orthodontic treatment, systemic diseases, and other factors. So the study shows that 46% of the respondents have no teeth or tooth replacement. And then the rest 53% have had tooth replacement. Well, this is a good sign in that community because the majority of people, they have gone for tooth replacement. So their attitude is positive and their knowledge because they were very highly knowledgeable. The reasons for tooth replacement among the respondents are function, because of function, they want to chew and eat properly. Comfort, they want to feel comfortable in the mouth and no sunk cheeks. And also aesthetic. So they want to look young and happy. So the function is the most common reason for tooth replacement. Comfort second and aesthetic last, which is also a good news because function is normally the first when replacing a missing tooth. So in conclusion of the study, in the light of the above findings for the study, the following conclusions were drawn from the results. So majority of the total respondents of the Carmen community with missing teeth within the age limit of 30 and 70 years old are very knowledgeable regarding replacement of missing teeth. So they were very highly knowledgeable. Second, the respondents of Carmen community have a moderate attitude towards replacement of missing teeth. So it's in the middle, not negative, not positive as well. It's moderate. It's the average. Third, there is no significant relationship between knowledge and attitude of the respondent regarding replacement of missing teeth. So there was no at all relationship because they were very high knowledgeable. So they knew they wanted replacement of missing teeth. They wanted to, and majority of them, they did go for tooth replacement. But those who did not go, they did not go not because they don't know, but because of financial reasons. So their knowledge was not affecting their attitude. Fourth, there is no difference on the attitude of the respondents regarding replacement of missing teeth when their age and gender are considered. Fifth, the study shows that among the respondents of the Carmen community, 13% visit a dentist once a year, 30% once visited a dentist once a year. Sorry, before it was once semester, and 10% visited the dentist once every 2 years, and 26% visited the dentist when they have toothache only, and the rest 20% have not visited a dentist yet, which is sad as well. That, as you can see, the 26% visit a dentist when they have toothache only, and this is also visible in many places in your country or in your area, even in my country, because some people, they still go to the dentist because when they have toothache. But as the world is evolving or advancing, many people are being knowledgeable and their knowledge is increasing, is being raised to go to the dentist or to seek for healthcare when they don't have diseases or problems. So for just a checkup, which is good. So this number is decreasing. But as you see in the study, we can see that 26% of the 100% visit the dentist when they have toothache. I don't know when in your country, perhaps a study should be done and see people who visit the dentist, who are they? How many, are there many or just few? Quite a number of people visited dentists when they have toothache. See, the sixth is that the conclusion, the factors which have contributed to the missing one or more teeth among Carmen community respondents are caries, infection, accident, tooth mobility, orthodontic treatments, and systemic diseases. I think these conclusions were kind of the same as the findings. So I will not repeat much, but as you can see, we wanted to see if there is a relationship between the knowledge and attitude toward tooth replacement. In that community, there was no relationship between the knowledge and the attitude because of the financial reasons that we have found. So in the tables, in short, in summary, as you see, the majority of people were very highly knowledgeable, high knowledgeable, and moderate knowledgeable. There were quite few, 10% only. And this is the means we used, so which I will not discuss much more. And also a table showing the means with every question or we discussed. And then also we can see the relationship between knowledge and attitude on tooth replacement, the correlational coefficient, which was not significant at all. On also males and female, it wasn't significant. So there was no difference between male and female on their knowledge on replacement of missing teeth. So this to show just the proof that the results in numbers that we've done. Yes, and as we continue, so majority of the people, 80% have visited the dentist, and then 20% have not visited the dentist. And then 10% quite visit the dentist once a semester, 30% once a year, as you can see on the table. And then the most reason for tooth loss was caries, but including also other factors. Also, majority of people, they went for tooth replacement. So they have dentures or bridges, but also we have also a big number with people who have no tooth replacement because of perhaps the financial reasons that we have discussed. And then majority of them went for tooth replacement because of function and comfort and aesthetic. So the recommendation, so they were like, we have to organize lectures or awareness so that we can raise the awareness of those people. Still, they were very highly knowledgeable, but still, we had to organize lectures on oral health and replacement of missing teeth, so that even those who don't have dentures, they can also go for insurances or places where they can get them for free. For example, in our school, or there were schools giving dentures for free and tooth replacement for free, but they did not know. So we had to organize an awareness seminar on tooth replacement so that they can also come for free dentures, free bridges. As I can see, dental lectures regarding oral hygiene, prevention and treatment of dental diseases. Then a funded dental mission. We had to organize dental mission so that we can help them, those who could not afford. Yeah, and then in conclusion of my lecture tonight, and I also encourage people who are following to like, share, and then also answer the questionnaires so that we can get your certificate later. So the conclusion of this lecture about knowledge and attitudes towards replacement of missing teeth or prosthesis. So most of the time, our knowledge influences our attitude. So if I know the importance of the role of a tooth, I will take care of my tooth. My attitude towards taking care of my oral health will be very high. So, but if I don't care about my teeth, so the attitude towards replacement of the missing tooth in case I lose it or I lose them will be very poor. So most of the time, when we are knowledgeable about something, our attitude also will depend on our knowledge. But as we have seen in the study, there can be also different reasons why our attitude is different or is not being affected by knowledge, especially financial situations. Dental care facilities are very far. We cannot find a qualified dental health care provider. So it's also a big factor that can affect our attitude towards knowledge. So as dental professionals, dear professionals who are listening and students, so our main goal is not only about providing dental treatments, rather it's all about educating and raising oral health awareness in our dental settings, in our clinics, and also in our communities. So prevention is better than cure all the time. So cure is very expensive nowadays, especially dental treatments are very expensive. But if we are able to educate our communities, the people who come to our clinics on how to improve their oral hygiene and the role and the function and the importance of our full set of teeth, we are doing the big part in their lives, and we are really saving their money, because if they take care of their oral health, they take care of their teeth, so that means they will not also spend a lot of money. So as healthcare providers and students, please, our primary goal is not making money through dental treatments, but rather it's about educating and raising oral health awareness in our settings and in our communities. Well, I've talked too much, but this paragraph, please, I would like to share with you with all my heart. Let's not profit in making money in our business or in our dental clinics, but let us raise and educate our friends, our community, our fellow countries, so that they can have a very good oral health status, and people being very highly knowledgeable about health, especially oral health. And one wise man said, knowledge will forever govern ignorance. So when you don't know, a person who knows will always be your boss. They will always govern you because they know. But if you don't know, you will always be under those who knows. And a people who mean to be their own governors. So those who want to be your own governor, if you want to be your own governor, you must arm yourself with a power which knowledge gives. Wow, I like this quote by James Madison. Knowledge will forever govern ignorance, and a person who means to be their own governors must arm themselves with the power which knowledge gives. So we have to do our best to increase our knowledge. And I really thank very much the EADS for organizing this International Online Dental Youth Congress. And the EADS is the only dental association certified to do so. So thank you so much for raising awareness in many countries in Africa, and we really are really proud of you. And it's a good step that you've made. It's a good example to other dental associations in our countries to do so and to do the same. Thank you. I hope you've gotten something, even if I've talked too much, many things, but the last part, slides were the most important. So do your best to increase your knowledge, especially oral knowledge, oral health knowledge, and also share to your communities so that they can go for more prevention than treatments, because prevention is always better than cure. Thank you. God bless you. This was Dr. Michel Mbonimana. So I give back the mic to the organizers. Thank you. This is the end of the presentation.